Io direi che la cosa più bella, sai cosa potrebbe essere?
Cosa?
Farla a me direttamente. Sai che sarebbe forte, no?
Fare cosa? Cosa stai
Quei
pensando?
fili, come ti dicevo, per questo sorriso che ho.
Li facciamo. Facciamo. Joint venture of two kind of threads, cogs and jumper, and also some filler to add up some volume where it's lost, like for example in this area here. We are going to fix all the elasticity problems and the gravity problems with this way. And putting jumper plus cog, we are going to mix the strength of both threads, so the result will be less longing. We will see if we are going to add also on this area here, but we first finish the upper part and then we see how much do we need here of product. So we start. Do you feel anything?
No. Ora sì.
Stai. Adesso?
Sì.
Troppo?
Ora no.
You just keep in mind, roll and pull. That's the only thing that you should do right. Roll and pull. Perfect.
No, già uno si vede.
Perfect. One is out.
Is it okay? Yeah.
We continue with the second one. Does it hurt?
No.
There are some fibrosis. We don't worry about that. We go on and then we start to do the grip. So do you feel anything?
No.
Does it hurt?
No.
If it hurts, you tell me, I move.
Okay.
Roll and pull. That's the only drill here.
Vrtiš, vučeš.
Yes.
Vrtiš, vučeš, vrtiš, vučeš.
Tako idu dve samo ili?
Pa, zavisi. Ona je njoj obeležila ovdje dve.
Da. Okay.
Znači i sa druge strane da povučem.
Dve tu, ovdje ide dvi, ovdje ide jedna.
Ali neće svuda svoje vrste.
A neće?
Ovdje će džamber, ovdje će kog.
Da.
Okay. Perfect. So we do the entry point. And we enter here with the 25G, which is a lower volume and a smaller size, because her skin is very thin and very fair. We could go in another patient with another type of skin. We could go with another jumper, like for example F23, which is larger, bigger, and but here you would see the jumper for 2 or 3 weeks. It doesn't make sense. So you choose the right product for the right candidate, for the right zone, right area. So We go on. Are you okay?
Mhm.
Perfect. 1. We will put a second one. We always try to go in 2. Like you see, in this area we go with 2 or we go with 3 when we want to broaden our area. You do like a V shape and you have broaden your area of biorevitalizing all this area here. If you go in 2 or in 3, you can go even 4 here in this patient. You don't feel the jumper, you don't see it. So you can go even with 4 pieces and you lower the quantity of the filler that you are using. Fillers last for 2 to 3 years, sometimes to 5 years. It's not true that fillers last 5 months. No. So let's start normalizing things, even us between each other. Because I hear colleagues which are saying that the filler lasts for 6 months. It's not true. Fillers last for at least 1 year till 5 years. There's been like tests to patients after 17 years and it's found the filler there. So, or residual of the fillers, if you want to be more specific. Yes. They are residuals of the filler, but it's still a foreign body inside you. With biorevitalizers like cogs or jumper or PDO threads, you will not have, which are hydrolyzed, you will not have a foreign body forever in you. So it will be dissolved by the body. Okay, you might have some form of fibrosis, but in the end, that's what you want. You create the fibrosis there, collagen type 3, and then after some time, your body will start to produce collagen type 1, depending on that collagen type 3, which is the fibrotic type. So we take the best of what we can. Now we are going to use the filler here, and I will show you how you can use filler together with jumper so that you can increase the volume of the jumper, but you can also prolongate the life of the filler which you put inside the tunnel of the jumper. So you will have this area here, which is an area which needs support always. You will last the life of your product, and also you will have rejuvenate the area. So it's 2 in 1. Show you now, you can implement, it's like a cannula because it's a cannula type. You just rotate it and it works exactly like a cannula. I will show you how we're going to fill the area. So we just primed it and then we start. Easy techniques which don't require effort and they are painless and without post-procedure trauma or problems, which is very important. You don't have your patients stay away from work for a week and you don't have your patients call you in the middle of the night, which is also very important. So it's good for the patient, good for the doctor. Now we push so that we are in and we start feeling. Does it hurt?
A little.
Here in the piriform fossa, we always aim the piriform fossa till here up, because if we leave this area unfilled or slightly underfilled, it will not be a good result. You can leave this area underfilled, but not the piriform fossa. Perfect. And that's it. And we use only half, not only half of the syringe, but like you use a smaller quantity of the filler, like 0.3. You can see it here. You have used only 0.3 of the filler to fill this area, which requires at least 1 to 2 milliliters per side for this structure, for
because
this patient.
You use it together with jumper.
With jumper. Yeah. You put it inside the tunnel And
Nice.
you can feel it also here. The jumper is also up here. It will also help lifting the ligament of the skin. Will also keep the product inside, and you have used just a fraction of the product you would have used if it was alone without filler. Just one jumper, 1/3 of a syringe, 0.3 ml. We just put the only 225 Gs here. I will add 2 more just to show you what you can do only with jumper, and then we will see with filler combined. So you can, because there is an option for you to, if it's not so deep, you can only use jumper to fill this area and you don't put any filler there. And the result is amazing, and the face doesn't look like a ball. It keeps the natural form, but it also volumizes the area. So, invention. Real invention. Le cose pronte?
Ma stamattina ti sei preparata?
Perfect.
Again, and we are done. And as you can see, all the threads come double packed for safety issues, so they don't dry out. They are double packed, and this also in a darker package, so it's not damaged by the light and by the humidity in the air.
You have to shoot, please. Interferon video.
The other part I needed to change side, so you might have some tiny drops of blood, but when we do, sometimes it happens that the grip becomes very strong. We go a bit and we release it, because we don't want it to be very pushy. It will, we will lose the result very soon if we do it like that. Because of the movement. The patient will move and we will lose the result. We have to do the grip as strong as we don't interfere with the movement of the face.
He can break easily.
Yeah. But if we do it like this, it will not break. And the drill is roll and pull. Roll and pull, remember. So we always count it and we up inside the skin. If you come here, you don't see the thread here. You make sure that you come like 1 or 2 millimeters. The thread should be 1 or 2 millimeters lower than the hole that we have done for the entry point that we have done. So we can use the same entry point. We are a bit superficial here. We go deeper in the smas. The beauty of the skin of the face is that it is connected here. I hope we are not making a hematoma here. It might happen, but in 2 weeks it will be gone. Cool. Perfect. Perfect. Thank you. If we see that we come more superficially, you go a bit back and you go in the right areas, because you don't want the skin to be you don't want the thread to be shown on the skin. You go just a bit deeper and that's it. And you start doing the drill. Here. You can put your finger on it, so you help the grip a bit. Here the skin is very, not dense, it's hollow. That's why you need to stay a bit longer to do the right grip. And you do it slower, you don't rush yourself. You go up and down, up and down. Does it hurt?
No,
Okay.
not at all.
We do the jumper implementation and then we continue with the filler. And then we have the nasolabial fold and the piriform fossa to fill. So one is out. Do I do it here? I need 2 more, please. Because I have 23, 25, please. Dalia. So. As you can see, it's very moldable and easy to use. It does what you want it to do. So here. Just a moment, please. I'll wipe her. Smile. As you can. It's perfect. Now I'll fix this area here.
Yes. We have done capolavoro. A few minutes. Give it to 1 hour.
Smile. That's okay. Perfect. It's fine. So. Let me clean her a bit. Magic. Disinfectanting.
Happiness.
Now we are done. Perfect.